Every heartbeat has a rhythm. Alright, so how do you tell if that rhythm is normal or it's not normal? In this video, we are going to go into what a sinus rhythm is, what a normal sinus rhythm is. If there's any abnormal sinus rhythm, we'll go into it, and then why it's even important to know. Okay, this is SmartNursing as always, and let's get right into it. A sinus rhythm is the rhythm that is originated from the sinoatrial node, just as we know in our conducting pathway that it starts from the SA node and then it comes to the AV node and then goes down like that. Okay, so anything that starts from the SA node is what we refer to as the sinus rhythm. You know, sinus, right? So it tells you that your heart is functioning normally, and then you don't need to worry about your heart, or there is no cause for alarm. But how do you see it on the ECG? What are the indications you see or the properties you will see that will tell you that this, my rhythm, is a sinus rhythm? First of all, you will see a rhythm that looks like this, okay? And then you will notice that there is a P wave that is present and it's upright, and it is before every QRS complex, and it's also of the same morphology or the same size. So usually when you take a 12-lead ECG, we use the lead 2 to monitor our rhythm. If you are lucky, you will have a longer lead 2 at the bottom of your ECG that you can use to interpret your rhythm. Okay, so you will see that there is a P before every QRS complex. That P, it is upright, and the P is also of the same size or morphology throughout. Additional criteria is that your PR interval, just as you can see from your P, the beginning of your P to the beginning of your QRS, we will call the PR interval, will be 0.12 to 0.20, which is 0.12 to 0.20, which represent 3 to 5 small boxes. You can watch the video, the link to the video above, where we explain what small boxes and big boxes are. Okay, so the PR interval will be 0.12 to 0.20, which is 3 to 5 small boxes. Then you will move to your QRS, which has to be within 0.12 seconds, which is your 3 small boxes. After that, look at your heart rate. Is it between 60 to 100? Your heart rate must be between 60 to 100 to make it normal. Okay, so if your heart rate is also between 60 to 100, then your rhythm is a normal sinus rhythm. Okay, I'll take that again. Your P waves are present before every QRS complex. They are upright. They are of the same size throughout the rhythm. Okay, then you have your PR interval, which is 0.12 seconds to 0.20 seconds, or 3 to 5 small boxes. And then your QRS is also within 0.12 seconds or 3 small boxes. Your heart rate is also between 60 and 100, or from 60 to 100. Then your rhythm, normal sinus rhythm. That means that you can have a sinus rhythm that is not normal, so to speak. Okay, you can have a sinus rhythm that is a tachycardia, or you can have a sinus rhythm that is a bradycardia, which means that you have some sinus rhythms that have all the properties we talked about, but the rate is a problem. The rate is more than 100 beats per minute. And you can see that in physiological responses. So if you have a sinus tachycardia, it means that your heart is working all right. Your conducting system is working all right. You don't have to worry about your heart. But it is responding to a physiological change or a physiological need or a pathology ongoing somewhere, which the heart feels like, maybe I need to pump faster. I need to increase the rate in order to increase the demand or meet the energy demand, or meet the blood supply demand, or meet the oxygen supply demand. Okay, so we see things like this in sepsis, where obviously you're going to be having a lot of hemolysis ongoing on, and then your oxygen is being affected, and then your heart thinks I need to pump it faster. Okay, or you can see it in shock. All right, so these are some of the situations where you can see sinus tachycardia. We already know that our SA node is controlled by the autonomic nervous system, isn't it? And autonomic nervous system is made up of parasympathetic and sympathetic. So if it's about resting and digesting, or it's about flight or fight, it's about pumping it faster or relaxing the heart, taking it easy, the SA node is there. So if your SA node is functioning well, your sinus rhythm will react to the situation as it deems fit. So you can have a sinus tachycardia and you can also have a sinus bradycardia. Now sinus bradycardia sometimes also are not usually problems. Sometimes they are pathological, sometimes they are not. Sometimes they are just also responses to some medications like some antihypertensives, or there are some athletic people who naturally have bradycardias, and then it is not really of a big deal. So these things are not diagnosed in isolation. Okay, you need to take into consideration the patient's history and the age of the patient, other comorbidities if there is any, before you conclude on what exactly the problem is. Okay, so some bradycardias may actually be a problem because you may having a sinus bradycardia, which would be like a first degree heart block, which can progress to a second degree type 1, type 2, and then into a third degree, which will become a big issue. So you need to understand what your sinus rhythm is, whether it is bradycardia, it is tachycardia, or it is normal, because you can also have tachycardias that are not sinus. Okay, we know that our sinusoatrial node is somewhere in the right atrium. So you can imagine if you have things like supraventricular tachycardias, that tells you they are not coming from the SA node. Okay, or you have ventricular fibrillations, you have ventricular tachycardias, atrial fibrillations, and all that. They are not coming from the SA node, and it is a cause for alarm. So it is very, very important to be able to identify whether or not your rhythm is sinus or otherwise. All right, so if you get your sinus rhythm, it gives you a baseline. It even puts you at ease. At first, you know that, well, my patient is doing well, the heart is okay, the conductive system is okay. You sorted that aspect out, and then you can concentrate on other causes of representation the patient brought to the hospital. So knowing sinus rhythm is very, very important. It puts you at ease, gives you a baseline, so that when you do an ECG the next time, you will be able to compare to what the patient came with, and then you will be able to tell whether there is something actually going well or not. So we've been talking about sinus rhythm so far. We've seen that the sinus rhythm comes from the sinusoatrial node, like we saw in the other videos, and we said that when it appears on the ECG, our P wave is upright. It is before every QRS complex. Our P wave is also the same throughout, or have the same morphology. A PR interval will be within 0.12 to 0.20, which is 3 to 5 small boxes. Our QRS will be within 0.12 small boxes, and our rate will be between 60 to 100. Our rhythm also, lest I forget, must be regular. The rhythm must also be regular. That means that the intervals between your R waves must be the same throughout. Okay, your RR intervals from one R to another R must be the same as the subsequent R's throughout the rhythm. All right, so that is basically it, right? Knowing sinus rhythm makes it very easy, and you are able to identify if something else is going wrong. For example, if you have a PR interval that is like 7 small boxes instead of the 5 that it should end at, then you know that there's a problem. Okay, or you have a QRS that is more than 5 small boxes, that's a widened QRS, and that is a problem. Or you have a P wave, you're not sure whether it's a P wave, then the next time another one comes looking at some other part, okay, that tells you that might not be a sinus reading. And so once again, this has been SmartNursing. Like we always say, ECG doesn't have to be this complicated with SmartNursing in your corner. So like, share this video if you found it helpful. Subscribe to our channel if you are your first time watching us. And if you're a returning subscriber, thank you very much for coming. You already know how we do. We'll see you in another video.